Drug abuse is a significant problem in Nigerian secondary schools. Now, many students use drugs like alcohol, cannabis, and prescription medicines, which in turn affects their health, schoolwork, and relationships. Now, the causes of drug abuse include peer pressure, family problems, stress, and also lack of awareness. To address the problem, schools, parents, and communities need to work together to educate students, provide counseling and support, and also enforce strict rules against drug abuse. Now, to speak more on this, we have two guests. First of all, we'd like to introduce Dr. Imisioluwa Ibikunle, Director of Clinical Psychology, Neuropsychiatric Hospital, Aro, Abeokuta in Ogun State. And we also have Ogurume Odafe Joseph, Convener, Global Advocacy Movement for a Better Society. Good evening, gentleman and lady, and thank you so much for joining us on the conversation.
Good evening.
All right, let me begin with Ogurume. Now, Ogurume, according to studies have actually indicated that drug abuse is widespread in Nigerian secondary schools, and with over 20% of students in Lagos State, admitting to using substances at least once. Now, I would love for you to tell us if these figures actually reflect, the national situation, or is there a notable disparity, when it comes to geography?
Okay, good afternoon, Nigeria. Good afternoon, Africa. I would want to say that figure given, it reflects, and I would even say maybe it was underreported, because what we are seeing in our secondary school days is quite alarming. And it is so sad to know that the issue of substance abuse in our secondary school, it has gone haywire, that if nothing is done, there is a report from NDLEA which clearly states that as of 2022, that report was carried out, that over 14 million Nigerian abuses substance, and a large chunk of that percentage are in our secondary schools. And that if nothing is done, by the year 2030, we have over 30 million Nigerians that are abusing substance. And large chunk are coming from our schools. Now, the scary thing about this is that the age range of these persons that are involved in this substance abuse is quite alarming. And there is this narrative before now that substance abuse is prevalent to the well-being quotes, but that is not the situation now from what we are seeing. I was privileged to do a tour around secondary schools here, some selected schools here in Delta State, where I reside. Courtesy the UWU, that is Urobo World Union Association, ably headed by Honorable Fidelis Akpeseri in the UK. And we're able to tour some schools here in Delta State. And it is quite disturbing, some of the reports we got, because we had an open section for some of these students to come out and, speak to us on certain things that they have been going through and what they have been encountering over time as students in that school. And it was mind-blowing what these guys have been going through and what some of them are still going through presently. So that figure is, I would say, it is even underreported, because what we are seeing now, it's massive, it's huge. It's such that if this is not nip in the bud, according to that NDLE report, over 30 million Nigerians, over 30 million Nigerians by the year 2030. Now, interestingly, 2030 is just 5 years from now. So don't think that it is 30, 40 years from now. No, we're in 2024, and 2025 is just at the corner. So we have just 5 years to nip this in the bud. Hence, we have over 30 million Nigerians abusing substance.
Okay, now let's hear from Dr. All right, let's hear from Dr. Ibikunle on this, on the percentage. I don't know if she agrees that over 20% of students, that's just in Lagos State, by the way. I want you to also tell us, if there are any significant differences when it comes, to the numbers and also when it comes to rural and urban areas.
Thank you. I think just exactly as he has said, it is actually on the report because the number is over 20% now. It's more than 20%. And it across the whole nation. There's really no place that is spared or better than other. And just like the studies, they have just told us that by 2030, it will even be more than 14 million from what we are looking at. And with no region better than other, with no states better than other, I think it's a general thing now. And I think it's now a global issue. It's now a global issue. And in Africa now, we have more than before. And even in schools now, it's more than before. Before in Africa, we don't used to have plenty students in school. But in school now, studies have actually shown that in every class in a school, you have at least 2 to 3 students abusing drugs, either illicit one, either alcohol, or prescribed medication.
Okay. Dr. Ibikunle, can you still hear me?
Yes.
All right. Now, studies have actually shown that drug abuse can lead to cognitive impairments, liver damage, and also mental health issues like anxiety and depression. Now, how does this translate to academic struggles mentally, physically faced by these students?
Thank you. First of all, when there is cognitive impairment, that means that learning will be difficult. And the area meant for, there is the front part of the brain, which is the frontal lobe, which is meant for, we call it executive functioning part of the brain. That place develops between the ages of 5 to 25. That is when it's fully developed. That is when an individual can take a decision, can do things, But it's unfortunate that before that area is developed in these children, they have already destroyed that part of their brain, meaning that many of them will not be able to take the right decision. Many of them will not be able to think right. Many of them will not be able to have good judgment about what is going on around them. Many of them will have poor academic performances just because of this. So by the time you put all this together, it's going to affect them. And the next thing is that when one is addiction is a robber. When they get addicted, addiction is a robber. It robs you of everything you have. And it takes over the whole brain. We say it hijacks the brain. If it hijacks the part meant for memory, what that individual will be doing is just seek, get, and use. You won't be able to store anything in that memory. If it hijacks the area that is meant for logical reasoning, that child will not be able to reason logically. Reasoning of that child will just to seek, get, and use. And if they continue like that, by the time they get addicted, when they use it, it's in their blood. By the time it's getting low in the blood, they want to take more, and that's how they go round that cycle, until their brain will not function again. Many of them will drop out of school, and they have these psychological problems. The one that is prominent is anxiety and depression. And as long as they are taking it, they continue to have anxiety and they continue to have depression. And with anxiety and depression, it's not only that they won't be able to function in school, they will not be able to function normally in the society or even at home.
And how detrimental is it for such
Eventually, this
students?
may lead to mental breakdown.
Yeah, how detrimental is it for such students, considering that their brains are still developing if they're in secondary school?
Yes, their brain are still developing and they're destroying that brain. So you can imagine such children, they won't be able to function in school. So that's why you see many of them, they drop out of school, and then in a bid to get money to get their drugs, they go into all sorts of things, like shady business, they do people, they do all sorts of things to get money. And as a result, they become deviant in the society. They are antisocial. And from there, they can develop personality problem, a personality disorder that can even make them to be dysfunctional, either in the school or in the family or in the society or in the nation as a whole.
Okay. Now let's hear from Ugurume. You've heard everything that Dr. Ibukunle has said. And according to the NDLEA, they actually said that substances like alcohol, cannabis, prescription drugs, like codeine and tramadol, and even as far as, inhalants like glue and paint thinner are among, the substances most commonly abused. Now, how easily can students access these substances both within the school environments and also nearby communities?
Now, in my tour in those secondary schools that we went to, one of the things I discovered is that there is high infiltration of what I call intellectual bandits in our secondary schools. And this is owing to the fact that the structure of those schools is like what we call in local parlance an apia way, whereby most of those schools do not have proper fencing. Most of these schools do not have proper fencing. And of course, I also attended a school like that while I was in Lagos, in Kirikiri, precisely at Jerome Felodun local high school. We had no fence. So what this portends now is that these students can easily be infiltrated by some of these, like I said in quotes, intellectual bandits who come into this school system. They meet at the back of one area in the school system to sell these drugs to these students, to even have, there's what we call a school outside the school system, in the school premises. So having access to this thing is just at the beck and call of these students. For those of them who will not want to access it in the school environment, they can easily take a stroll out of the school because the school do not have proper security architecture. So it is no longer difficult. And again, with the use of social media, with the use of phones, in our own time, when I was in secondary school, there was, in fact, I did not remember of any student that has a cell phone with him or her. But today, if you go to even our primary schools, the pupils come to school with phones. So they can easily just do a chat on their WhatsApp and call in these guys that will bring in those drugs for them. And they go one place, maybe in the toilet, in the bathroom. Now, I will tell you a story that happened in Ugeli. I won't mention the name of the school, but I know most of them who live in Ugeli will know this story very well. And the school is over 30 years old. That's why that school has been in existence for a very long time. Now, over 6 to 7 students were caught with this, what we call open miri, this ice stuff, and also some other cannabis and some other drugs. They were actually giving these things to female students so they could have sexual knowledge of them. Now, the school environment caught them. Now, because they were over 12 to 13, what they could have done is perhaps to expel them, although that is not the right approach to expel them. But, in most cases, what schools do most cases is to expel them. Now, what the school actually did was that the school authority had to bury that case so that it won't get to the public. This thing happened right in our nose. Another one also happened here in Warri. So students get access to these things because we have people going to school with phones.
Ogoruna,
said,
so what you're saying is that, there's actually evidence of drug trafficking networks targeting schools in Nigeria.
yes, they are.
So
Yeah,
how
they
effective
are. Like I
have,
said,
law enforcement interventions been?
now, you see, it is not out of place, because they will be treated as minor. And that is why sometimes a bit, those law enforcement agencies are kind of a bit handicapped to a large extent. But albeit we have seen a case whereby in that same school, a student was traced by the AFCC for illegal possession of drugs and internet scam. We'll come to that as some of the consequences of substance abuse in our school. So yes, the law enforcement agencies can also do a lot in this state. But like I said, because these guys are minor.
What
So
about
most
the drug
cases,
traffickers themselves? Not
yes.
the students. I'm actually talking about the drug traffickers themselves.
The drug traffickers.
Yes, the law enforcement
Yes,
agency.
definitely.
How effective have they been in
Yes.
arresting them and nipping their activities in the bud?
Now, you see again, like I told you initially, I said most of these schools, they lack security architecture. Now, most of these drug peddlers, note, these guys are very ferocious. And perhaps you have a 65-year-old man who is the gate man in the school there, maybe a retired security man or maybe a retired legion officer or something, who is just there with a stick or maybe a wood. And you have about maybe 5, 6 fearsome-looking boys who infiltrates the school system, goes to the back of the school and start doing their activities. that man does not have what it takes. And that is why in one of our recommendations in our tours around these schools, we also advocated that schools should have proper security network in such a way that there will be telecom that communicates from the school point to the nearest police division. Do we have this in our school system? The answer is no. How do you expect a 65-year, 70 years old gate man with just one stick to go to this, would I say, like I said, intellectual bandits or school bandits to apprehend them? I think the only school we have so much security network was when the former governor of Kaduna State, Malam El Nasiri Rufai, had to put his own son in a government-established school. That is when you see all the security apparatus stationed in that school. But when it comes to the plurilaterals going to schools, you don't see such. Even the middle-income earners, the so-called private schools, even lack the same security architecture in their schools. So how do you intend to apprehend these guys? It's quite difficult.
Okay.
It's difficult. So they must up their game in terms of security architecture.
Okay. Now let's come back to
and communication between the school and these law enforcement agencies.
All right. Now coming back to you, Dr. Ebikunle, is there a noticeably difference, in drug use patterns between male and female students? I'm asking because I'd love for you to tell us what age group is most at risk of initiating drug use and why?
Okay. Studies have shown that boys take drugs more than girls. And studies have actually shown that the boys, they abuse more of alcohol and cannabis, but girls abuse more of some of these prescribed medication and also cannabis too. Then you know that when you're talking about abuse or misuse or addiction, one thing you need to take into consideration is the availability of that drugs. When anyone is into addiction, they abuse drugs that are readily available in their surrounding, the drugs they are used to. And many times, because I have been a drug counselor for about 35 years, I have been counseling drug addicts, rehabilitating them. I found out that it will shock you to know that many of these students, Many of them, not all of them, they don't abuse drugs in school. They abuse it outside school. But the problem is that when they abuse drugs, it's in their system and is working, and it will affect their education. But studies have shown that girls abuse a lot of drugs that will calm them down, like that will quench their anxiety and will enhance their sex performance. But boys abuse all sorts of drugs. That is what studies have shown us.
Okay. Now, still on you, drug abuse or drug use,
Okay.
we know that it often leads to behavioral problems, like aggression, mood swings, and even isolation, and this in turn
Yes.
affects, students' relationships with their peers, their teachers, and even their parents, So how do these issues, manifest in Nigeria schools?
Okay. Actually, what we call it is drug abuse and behavioral disorder. That's what we call it. Because there's nobody that will be abusing drugs that will not have behavioral disorder. In Nigeria, it's rampant. Everywhere. Everywhere, every nooks and cranny, you get youth, adolescents that misbehave. And if you look at them very well, you see that many of them are acting under the influence of drugs. Sometimes they become so lawless, they are rude. Even rude is even an understatement. And that's why there's nothing they don't do. They commit crime at will. They abuse people. They rape. Even they gang rape. That they do thefts. All these crime in the house. Even domestic violence, because we've heard about even adolescents killing their father or their mother or their sister or their classmates in school. It's happening now in Nigeria. So all these things are done under the influence of drugs. And another thing that when they take drugs and the drug is no longer in their system, when they are craving and they probably don't get drugs, or that craving mixed with other psychological issues with them, they get so depressed to the extent that some of them actually commit suicide.
Okay. That's really, really, scary. Now let's come back to you. Ogurume. Now, Ogurume, looking at the, immediate policy actions, that the Nigerian government should take, do you think that they should focus on stricter laws? Should they focus on, prevention programs or rehabilitation efforts for these affected students?
Now, the idea of stricter laws to this issue is not the panacea. Rather, in my local parlance, there's something like, instead we will go hold fights, make we settle quarrel, which means I have always been an advocate of let us prevent these issues. And once you can identify the causes of these issues, then I think preventing them will not be much of an Herculean task. I have just cited one, the lack of or the failure of the school system in terms of emphasis on substance abuse, having it as a curriculum, although that will come up as recommendations. But when you have these, then also I talked about infiltration of these schools by bandits and the likes, in quotes. Now, when you have good structural systems in place to see that these students do not in any way get associated with those outside there who are already deep into these things, you see that you have less problems to do with the issue of enacting stricter laws, because when you say enacting stricter laws, those laws will be more punitive rather than corrective. So we have always gone for corrective measures. And these corrective measures has to do with, one, how has there been what I call family social life, to see that, because one of the reasons why you see these students do what they do is because even at the home front, they are lacking a lot. I will tell you this, I turned down an offer to work in Lagos because my family is in Delta State here, and I know what that distance would do to me. So the issue of this family's social life is not there. And emphasis are not being placed on this. And that is because perhaps the nature of our job these days, the 6 to 6, the 6 to 11, and all sort of, has also created this gap between parents the students, which of course are the children, and their parents, because we cannot in any way rule out these when we come to the issue of substance abuse. So for me, I will not go for stricter laws. Rather, I would say let us have corrective measures. And this has to be in form of preventing these things, educating these children on resisting peer pressure, educating them on self-esteem, because one of the also core cause of this substance abuse is when they have low self-esteem.
Okay, Ogurume, thank you for that, by the way. Now, just before we wrap up, let's hear Dr. Ibikunle's final thought in just 1 minute, if you can. Now, we know that some of these schools aren't equipped, enough to even have mental health professionals. How then can schools incorporate counseling services to help students with drug abuse problems?
Thank you. First of all, we need to understand that when we are talking about when we are talking about how do we eradicate it, we look at it as biopsychosocial. Biopsychosocial, the bio of it means that, and studies have actually established that drug addiction is a disease, is a brain disease. It will affect the brain just as hypertension will affect the heart, or pancreas will affect a diabetic patient, or diabetic will affect the pancreas. That's exactly the way it is. So when we look at it as a disease, then it needs treatment. Then the social aspect of it is that it's established that the social problem of a generation becomes the psychological problem of the generation they produce. So the psychological problems we are looking at now is as a result of the social problems that the earlier generation has caused. Just like he said, we need to enforce this a family system, this home system. We have to know that parenting is a business. If you are ready to be a parent, then you should be ready to go into that business. Then the psychological aspect of it is that they need to be treated, they need to be rehabilitated back into the society. Because we don't look at them as outcasts, we look at them as somebody that needs help. And indeed, many of them can really be helped. And concerned schools, like when I was in UNODC, there's a program UNODC was doing for counselors in schools. I think at that time we trained a lot of counselors, but from all these unity schools. So Nigeria can do that for all schools. They should all have counselors that is going to be trained and going to be counseling people on drugs, so that prevention is actually better than cure. Those that have not entered into it, let's help them. Let them understand what they are entering into. And those that have entered into it, let's treat them. Let's rehabilitate them back into the society.
Okay. All right. Well, thank you so much, Dr. Monsieur Lua Ibikunle, for speaking to us, Director of Clinical Psychology, Neuropsychiatric Hospital, Aro Abeokuta. And we also had Ogurume Odafe Joseph, Convener, Global Advocacy Movement for a Better Society. Thank you so much.